Hi, my name is Jeri Shaw, and I'm the moderator for tonight's program. I'd like to mention that I am no stranger to the foundation. I live 3 blocks north, and I remember the construction of your school and mosque. And as a member of First Church of Lombard and a member of DuPage United, we have worked with friends here on numerous county and community mental health issues over the last 8 years. We have had breakfast together, cleaned the bike trails together, table discussions, interfaith services, and over the last year, I have been welcomed on the bus trips to Washington, DC and Chicago, marching with friends here for peace in the world. Your hospitality and commitments are most admired by my church and by me. Tonight, we get to discuss what is in front of us the next few weeks. We have the right and opportunity to share our individual voices by casting a ballot now on through November 5th for those that we want to lead us. We will also be presented with several referendums on our ballots, but specifically a referendum to form a community mental health board. It will be near the end of the ballot, so we're telling people to look at your whole ballot. Sometimes they get forgotten. A few years ago, in conversation with now retired Lombard Police Chief Newton, I learned about mental health boards. I had no idea what they were, and that my township, York Township, did not have one. As a special needs teacher, and with my work with mental health issues in the county, I know firsthand the need to expand our services in mental health, substance use disorders, and developmental disabilities. There are way too many gaps, even a county as rich as ours. These issues, when not addressed, profoundly affect our community and our families. Over the last several years, 5 mental health boards have been formed by referendum in DuPage County. York Township, that's our township, is adjacent to 3 townships with mental health boards: Addison to the north, Bloomingdale to the north, and Milton Township to the west. Before we start the program, I want to thank you all for attending and the Islamic Center for hosting us, and our 3 great panelists, Dr. Fahad Khan, Dr. Amar Safdar, and Dr. Saima Asfar. We will learn about their backgrounds in a bit. I'm really excited to learn about what they're doing. If there are any elected officials here, and I don't think there are, we will skip that. The goal of our meeting tonight is to provide information so voters can make an informed decision and to motivate them to participate in this particularly important election. We hope you will share what you learn with your friends and your neighbors. So we're going to go ahead and review how 708 boards work and what they do. Before beginning, I'm going to read a list of some facts about what mental health boards do. It's a very generalized list. In practice, each mental health board is unique, just as the communities they serve are unique. So they fine-tune them towards what their community needs. These facts will be the basis of our discussion. And here are our basic facts, and we have about 9 of them. Okay, the first one is community mental health boards provide no services directly. They are not service providers. Mental health boards provide small yearly grants to providers of services for mental health, substance use disorders, and developmental disabilities. These providers may be nonprofit, other governmental agencies, or even for-profit agencies. The grants do not go to individuals. All grant funds must be used to serve members of the community, so grants would directly benefit community members in York Township. Grants cannot duplicate existing funding. They fund programs and services that are demonstrably underfunded, so they're underfunded or not funded at all. Mental health boards are funders of last resort. The grants are reviewed and awarded by informed members of the community appointed to the Mental Health Board who have demonstrable, professional, or personal, I call it lived experience, knowledge of mental health, substance abuse, or developmental disability. I hope we can get some Muslim members on the board if we get to have. What to fund is determined based on surveying the community needs. On a 1 and a year, 3-year plans, the boards are required to update yearly. And the amount of money available for funding by the board is approved by the governing body based on the recommendations of the appointed mental health board. So those are the community members. The maximum amount listed on the referendum is 0.05%, a fraction of a percent. This would equate to $16.67 for every $100,000 assessed valuation, or about $50 a year for a $300,000 home, which I think is about our average in the Villa Park area, at least. Lombard might be a little bit more. That is the absolute maximum amount. The actual amount will be approved by the governing township board. The amount suggested on campaign literature, and is that based on that material back there, Mike?
Yep.
Based on other boards in DuPage County and across the state is 0.025%, which equals like $8.50 for every $100,000 of assessed valuation. All the items I mentioned here are described in the literature on the table, along with other information. And now that we have heard the groundwork, I would like to introduce our panelists by asking them about their background and their experiences. Briefly, Dr. Simon Asfar, Chief Strategy Officer for ICNA Relief, Dr. Amr Safdar, Chief Medical Officer, River Edge Hospital, Forest Park, and Dr. Fahad Khan, Deputy Director of Khalil Center, a Zakat Foundation project. And the question is, what was your pathway to social work or mental health community? And summarize your background and your experiences and your pathway of how you got to where you are today. Briefly, if you can. Would you like to start with Dr. Simon?
Thank you so much, Jeri.
You're welcome.
Yes, and thank you, Mike, and thanks to our panelists and those who are present here. So my name is Saima Asfar, and I live in Glen Ellen. This time, when you heard of ICNA Relief, usually people think of food pantry or refugee services or this type of work. But when I joined this since 2010, ICNA Relief office was just in my neighbors, and I started as a volunteer. And when I start meeting with people, it just changed the way I think about happiness. It's just so rewarding. And anytime you start helping others, start food packaging, backpacks and others, and then we started helping, and brother, Fahad is part of our initial way back. He was part of those meetings when we were thinking of starting the transitional housing program in ICNA Relief. So when we started our transitional housing program and self-sufficiency program of refugee services, we learned that mental health is one of the roadblocks. Mental health issues are one of the roadblocks in self-sufficiency. You can provide housing to a person, you can give them food, you can give them, job, you can provide them car and driving lessons. But if they cannot think straight, or if they're so overwhelmed by their PTSD or depression or many other things, they're unable to, function. It was the major roadblock in the self-sufficiency. So that's how I got into this area, and we started meeting and building relationship with different organizations and partners, and see how we can help our community better. And that's how I got in touch with Bloomingdale Township. Mike has been amazing. I was telling earlier too, that he has been an amazing glue, amazing force for our community, where we understood that we are not alone. We don't have to, think and worry alone. We have our neighbors. We can join hands and we can work for this cause. So that's the background.
Thank you. Thank you so much. Dr. Elmer Safdar, would you like to go?
Thank you. Yeah. So I'm an adult and child psychiatrist, and I'm originally from Pakistan. I've been in the US for over 30 years now.
Please speak loudly.
Sorry. So I'm a child and adult psychiatrist. I work in a hospital, River Edge Hospital, and also have a clinic here. And I have witnessed firsthand a lot of the problems that the community faces. Well, I mean, mental health is not, confined to one demographic kind of group or anything like that. It's everywhere, every community and every, ethnicity, people deal with these type of problems. And so I get a lot of referrals even at my clinic here in Lombard from our own community. And I see children who come to see me that sometimes their parents don't know that they're coming to see me. And I see parents and I see, spouses, and I see all kinds of people. I see refugees who have come here, who have been through tremendous amounts of trauma. And so I'm just talking about our community, but I see people from other places. I've seen people coming from Venezuela who have walked thousands of miles to get here, and the kind of incredible hardships that they have faced. So at the same time, I also recognize that the need for mental health is growing, it's not diminishing. So there's a need, like Sister Sama is talking about. When people's lives are broken, they physically may be together, but emotionally and mentally, when they are suffering, it has a permeating effect on every aspect of their lives and the whole family, and sometimes the whole community. You see one person struggling with mental illness can have such a profound effect on everybody. Or if you have a child with special needs, that affects the whole family dynamics and people around and everything. And you need a whole umbrella of services around, from making sure that they have adequate housing, to food security, to mental health needs, to services at the school, and all those things that kind of come together. I think that we've had a lot of services available, and I think DuPage County is still a very, very good county. But the fact is that there are people who fall through the cracks. There are people who have private insurance. There are people who have Medicaid, but Medicaid has been outsourced over the last so many years to managed care. So managed care has a different model because managed care is based on profit making. So their focus is to give as little service as possible so they can have more profit for their shareholders. So then there's some people, they don't even have that. The people who don't qualify for Medicaid because they have a little job, but they make enough to not qualify for Medicaid. So these people, I think, will be the people who will definitely benefit from community mental health board. And I think that's what we're learning from our sister townships and other places, that this is like really an important aspect in this day and age when the dollar amount is shrinking. In many areas, there's budget cut downs and everything, and the need is greater than ever. And we have had the pandemic, we had COVID, we've had other type of crises that are happening. And I think in particular, our community is really struggling. We have people who have family members who are dying right now and things like that. Yeah. So there's so many layers of, like why we need this. So, basically, I mean, I don't know if I answered the question about my journey, but we're looking more at what we need right now. Yes, thank you.
You're from Pakistan.
Yes. Thank you.
You're welcome.
Yeah,
Go ahead, Dr.
I'll talk about my journey, I suppose.
Okay.
And Dr. Safdar is part of the journey, so.
Oh.
Yeah, I mean, when I was doing my undergraduate education, I was pre-med, and then I graduated, then I did a master's, and I was still pre-med. And one thing I didn't at the time know that I had some anxiety and ADHD in my family. I had no idea about it. And my parents didn't know, obviously. And so I would look at all these students in the library sitting and studying for 6 to 8 hours sometimes. And I'm like, like, how do people do that? Like, how can you sit and focus for that amount of time? For me, 30 minutes, 40, maybe an hour, and that's it. I'm totally tuned out. And so at the time I didn't know, obviously. The reason Dr. Sufder is part of it is because when I was studying for my clinical psychology exam, I took it the first time and I missed it by like a question or two. And so I was having difficulty sitting and studying. There's so much information that you have to, remember and recall in such a short amount of time. So I went to him and I said, I think I have ADHD. I'm not sure, but these are the symptoms. I did an assessment of myself. At the time, I had not gone to a psychologist. Based on my own assessment of myself, I feel like I do have it. So he said, why don't you try this medication? And so like, okay, so I went to my primary care physician. He prescribed it. And it was like going from missing it by a question to like comfortably passing the exam. The difference it made in studying and taking the exam was like, night and day for me. And I'm an educated individual who was a psychologist and still needed that to figure out, it took time. So, I know a lot of people, like you said, in the community who have no idea about any mental illness issues. What does anxiety look like? A lot of the people that come now, I'm sure Dr. Safdar can attest to this too, is young children or teenagers who have ADHD, for example, or substance use is common. Oftentimes behind that is just, family dynamics, lack of connection with the parents, or maybe even trauma that leads to those type of symptoms. And so if you just inform the parents and work with the community and create a healthy community overall, I think you can alleviate a lot of those issues. And so Khalil Center, when I joined it, we're focused on a very spiritually integrated approach from an Islamic perspective, which highlights two important aspects that are very important for, I think, mental health, at least in this day and age. One is the importance of community, the importance of family, the importance of social connection. There's a reason why we're asked to come to the mosque. There's a reason why is like you have your neighbors have a right on you, for example. You have to be connected with people around you. And we know through research, I think it's at Harvard, the longest study on mental health. One of the outcome that or the finding was that people who are more socially connected are more happy. And we know that that we do, like having that family connection can be very helpful. And the other area was spirituality, because when people struggle, they go to religion. They try to comfort themselves through prayer. So we've been focusing on that. And now we've kind of shifted a little bit of that focus towards prevention. So this is where I think strengthening the community, helping people, this is where I think this money would be probably best used, because we don't want to be behind, we want to be ahead of the problem. And so if we can identify how we can strengthen families, marriages, how we can, sustain those connections, through the community, having programs at the mosque. The programs that we've had here on parenting, mental health have been very successful and well attended, because the approach wasn't, we're doing a program on depression. It was on, parenting and how to connect with your children. And we did a class here last year. It was like a 8-week long class, and every Sunday morning people came and attended, for, I think it was 2-3 hour class every Sunday for about 8 weeks. Because they wanted to know, and some people weren't even parents. They're like, we're going to get married and, we're engaged, or we just got married, we're having children, but we want to know how to be better parents. So we've shifted our focus towards prevention so that we can strengthen the community so that, children don't have to struggle. Unfortunately, the system, like you were saying, is set up in a way that, it's going to lead to more mental health problems. Especially for the Muslim community, but even community at large. What's happening in the Middle East, if you look at that, or if you, the election coming up, the stress around the election, we saw that happening in 2016. The anxieties went up. And then on top of that, if you have, job loss or the cost of living has increased. So both parents are working. There's not enough time given to the children. So all that is just kind of leading towards a very bad future. And I think the only way we can be ahead of it is if we work on the preventative part. So that's kind of been like the focus of Khalil Center. And even myself too, and now my own personal journey is to like inform people. And, when I see people, it's like how to alleviate and how to help them through the shame of like, if you can't sit and study, there's something you need to work on, right? And it can be worked on. And, I mean, I've gone to therapy myself, so I've been going for years and I enjoy it. But there's a lot of people who feel a lot of shame and stigma. So part of the work is to alleviate that so that they don't have to struggle like I struggled. Yeah, but thank you for that question.
Well,
Hmm.
my whole family is ADHD, self-diagnosed, so, well, actually, no, my daughter had it and the grandkids too.
How do you treat the people with mental?
I don't know, that's what
Like
you want.
from your talk, we came to know like the causes and the prevention. But besides medicine, how do you treat?
Yeah, so you have,
People with,
I can, you want me to?
Go
should I?
ahead,
Go ahead.
go ahead.
Yeah, I mean, I think treatment depends on what the root cause is, right? So some mental illness has a very pure biological reason,
Mhm.
something in the brain, something in the genetics. So that's where medication is very important. Like some people have schizophrenia, some very bipolar disorder. Those medications are very important. So that's where the first person to see would be someone like a psychiatrist or primary care physician. But most of the issues is related to family issues, stress, and not having a good, strong connection with people. And with technology, unfortunately, we have lost most of that connection too. So people don't
Yeah.
have that. So depending on the
Besides-
problem.
Besides medicine, how will you
Yeah,
treat? the
Yeah,
person
therapy.
with-
Yeah, counseling and therapy. So that's, I wish I can tell you in 1 minute how therapy and counseling works, but it's very complex.
That's, it.
Yeah.
I mean, like you are trying to get a system established here, so everyone have access to it.
Mhm.
Yes, yeah,
Basically,
everyone.
that's what we are trying to do here.
Yeah.
So basically, like, just like any other condition, when you have a health problem, you have a fever, you have a cough, you go to the doctor, they do some tests, they examine you, and they recommend that, this is the treatment. A lot of times it's medicine, not all. Sometimes they will recommend physical therapy, sometimes they will recommend some other type of treatment for you that they think is appropriate. So the current model that we use in mental illness is called the biopsychosocial model. And we believe that people have mental problems because either there's a biological problem, which means you inherited something, it runs in the family, or you have genes that are kind of manifesting that. Then there's a psychological part of it. Psychological is your personality. How do you handle stress? How do you see yourself? How do you interact with the world around you? What are your coping strategies? And then there's the social component. The social component is, what are your circumstances? If somebody's homeless, if somebody's lost a job, if somebody lost a parent or a spouse, or they have housing problems, or they're getting abused, then, so the treatment is also biopsychosocial. The biological treatment is if somebody has a chemical imbalance, they get medicine.
Like you are saying the causes.
Yeah. So then psychological,
Besides medicine, I think emotionally,
therapy,
we have to do something.
psychotherapy,
Yeah.
psychotherapy.
Emotionally, we have
Yeah.
to see to the emotion.
Mhm,
So
absolutely.
psychotherapy is a part of it. Psychotherapy, you meet with a professional, it's either a psychologist or a social worker. When it's a psychologist, they call it psychotherapy. When a social worker is talking to you, they call it counseling, but it's very much similar. So same thing, you talk to them, and when somebody has social problems, you try to get some help for them in that area as well, like, get some advice about housing, benefits or whatever, or, help them if somebody's getting abused, a child is getting abused, you call DCFS, Department of Children and Family Services, if they can help, or, there are different aspects of it. So you have to identify what the problem is, then you come up with a solution. The difficulty is a lot of these services are there, but people who don't qualify for these benefits, they are the ones that need this type of
Yes. the
service.
mental health board.
Community Mental Health Board. So Community Mental Health Board is the idea, it's been around for like 50 years now. But basically what they do is they will take 6 or 7 members from the community who have some experience or some background, like Jeri was talking about, and they will form a committee. The committee will then start making recommendations and identifying areas where they can help, whether they're helping a school, they're helping in a shelter, they're helping, with housing, with mental health needs, with children with developmental disabilities, born with autism or born with Down syndrome or other types of problems, or, other types of services, substance abuse, people who are, it's everywhere, addiction is a big, big problem. So then they will identify, they will recommend, and then there will be some dollar amount that'll be given to some places where they can provide services to people who are otherwise not able to get those services. So it's like filling the gaps.
Falling through the net, they're not poor enough
Yeah.
to qualify for, the government aid, and they're not rich enough to or don't have jobs to
Right.
qualify.
To have
So
insurance.
it's to get those people in the net.
Yeah, you explained very nicely.
Thank you.
Okay, our next question is, how does the Muslim community engage with 708 boards and the system of care for mental health, substance abuse, and developmental
Please say
disability?
loudly, we didn't hear.
Sure. You want me to repeat that? Yes. How does the Muslim community engage with 708 boards and the system of care for mental health, substance abuse, and developmental disabilities? How can we increase that involvement? And how can we involve the greater community to engage with Muslim providers and charities? What do you think about that? I don't have an answer. Well, I do have some ideas, but.
Yeah, I can start. I think, because we've been part of 708 mental health board, not the board, like a recipient from Bloomingdale Township.
Yes, speak
And-
loudly about that.
Yes, we have been.
Yeah.
So the thing is that when all the nonprofits, especially in Muslim community, when you are trying to establish yourself, you have to continuously, work on sustainability. We don't receive enough government funding or grants. It could be any reason, either we're not applying it, we're not equipped enough, or we don't know where these grants are available, or maybe there are none available, altogether. So, and then we rely on zakat, which is the, charity which come from Muslims. And that has some limitations, sometimes understanding. So if I have two, needy people in front of me, one is in looking for food and other one is in need of mental health counseling, I will give my zakat to one who is asking for food or is looking for the, housing or something. So that's the challenge which ICNA Relief face. That we, whenever we ask for funding, alhamdulillah, our community donate generously. All the mosques, they support us. Alhamdulillah, they give us money for transitional housing, for the food, hunger prevention, refugee services, but not for mental health counseling. And mental health counseling is a thing where you need a continuously a counselor or, clinicians in your staff. Otherwise, it won't be like if you don't have clients or patients, you can let them go, okay, come back next month whenever we have, patients. So we have to provide them, consistently we need support, right? So we really, really need that support in our transitional housing program. We had children, we needed support for the kids. They needed counseling. Like I can tell you a story of, there was a sister who came from Afghanistan as a refugee. And the trauma of being refugee, it's huge. When she arrived here, there was domestic abuse situation. Her husband started the domestic abuse and he kicked her out from his housing. So she became homeless. So imagine the trauma of refugee, trauma of becoming homeless. And then somebody put her in a homeless shelter with her 4 children. And then they were not eating food because it was all not halal, she didn't know. Nobody was able to communicate with her. So she was in desperate isolation. All of her family members, herself and her 4 kids went on hunger strike. They stopped eating. Then somebody found out, they took her, this brother took her to masjid and masjid referred to ICNA Relief. And then eventually they were at our transitional housing and we kept them for 1.5 years. And then we provided all the support, but we needed mental health counseling because they've been through so much. And that's how, I mean, that's where we needed continuous support. And then when Mike came to us, I think it was 4 or 5 years back. And he told us, hey, there is some help available. You are not alone. So we applied to Bloomingdale Township. And I think since last 3 years, we are receiving support for part-time social worker who could take care of these transitional housing sisters. Now we have interns, we have a supervisor with other support, community support, but the need is huge,
Yeah.
Need is so big that we really need, the issue for
Yeah.
our community
Bring
is
that up.
bilingual, clinical counselors. We serve 88 nationalities at our program.
How many
So-
languages is that?
So right now 15 languages plus. Our staff speak 8 languages. So it's so hard to find, clinical
Translators.
counselors in Rohingya, let's say, or Farsi or Arabic, and alhamdulillah, we have some Urdu speaking, but it's hard to find, they're hard to find. So we need, if we could apply, we applied in Milton Township too, hopefully we can get some support from there. If we have, this township have 7 or 8 board here, mental health board, we would love to apply because our clients are
Right,
all over
township.
the place.
Yes. Yeah.
So I think our community should understand and they will understand that these type of boards are crucial for our community member, for everybody, who
Right.
is in need.
So I'm hearing your clients, that some of the issues with the people that you serve is language, the trauma that they've endured coming here,
Yes,
as well as the food, the diet.
yes,
Yeah.
yeah, cultural
And cultural.
insensitivity.
Yeah.
Yes,
Yeah.
racism, there are so
Yeah.
many things, bullying, when kids go to school.
Yeah.
There's a lot of bullying, which is, we have seen grown-up Syrian men crying, in tears because they can't support their kids in the school. They don't know how to. So it's there.
So then conversations with the school districts too.
Yes,
Yeah.
yes, absolutely.
Yeah.
So we are
you.
super thankful and grateful for these initiatives. And I'm sure inshallah, we all will support this. Inshallah.
Yeah. Do you have anything to add to that? That was a lot.
That's really important. It's a growing problem and it's only growing big.
Yes, yes.
It's at every age level, like you said, it's a big issue with the children getting bullied. Even the children that are born here, they are being bullied and they can handle. And they get so angry, they're thrashing, and then guess who is involved? The police. We don't need that. If
No.
we have these things here, we don't want to expose our children to the police and
No.
all that stuff. That route is just gonna ruin their life,
Yeah.
period.
Yes.
Yeah.
So we need to protect that.
Well, and that makes me wonder too, I don't know what kind of cultural engagement you have with the police departments in the towns that you serve. Is there any engagement that you have regularly? Because that is something that certainly we should definitely have, because we've, over the years, over the last 5 or 6 years, we've had specific training on anti-bias, more for, African Americans and that kind of thing. But I mean, bias is bias.
Mhm.
And maybe we need to be more culturally aware of the different cultures that are in our community, and that would be an education project for our police department and the community members who serve in those roles, engaging with the community regularly.
Yeah.
Especially if it's a negative engagement.
Yeah.
Sorry,
No, no,
the cities have the social services department as well. I know the city of Wheaton does. That are on call, and they also educate their police department.
So that's good to know.
So like, we were part of the Citizens Police Academy,
Mhm,
the Fire Academy, so it's really good. But it also takes us to be part of that as well and
Yes.
engage with them.
Yeah,
And then also educate them with the issues that are happening in our community as well. So it
So
goes
that's a
both ways,
need.
right?
yeah. That's a
And
need.
then I actually had a question, what are
Go ahead.
Islamic or institutions doing to support, our community? I feel like that's a huge lack. You know, we're building these huge massages,
Mm.
but what services are we providing?
Mm.
You know, I feel like it's really lacking, and if we had a social service. A
In
social
each-
worker on site.
Yeah.
Where they can come in, talk to, or have office hours, or have somebody who can go around the different. Institutions, that would be great.
Hmm.
It's really lacking, and I think, you know, people are fearing coming to the. Institutions, instead they're going to church support groups. I have a friend who just, you know, going through grief.
Mhm.
With her mom passing away, is going to church support group because there's no
There is no.
Islamic
Oh,
grief counselor.
Yeah.
yeah, I know some of our
Every
Christian
Islamic center should have every.
churches
mosque
do
should
have
Correct.
grief support.
Mhm.
We used to have a parish nurse, so our parish nurse would do all kinds of things with people. Probably a little bit of mental health, but not so much, but we
Really?
don't have one now. We could use one again.
I think Khalil Center is doing a lot of work.
Yeah, I know, and they're overwhelmed. Every
Yeah.
time somebody's trying to call
It's
Leo Center, they're booked for like 6 months.
Yeah.
or-
I think
But,
Islamic.
So that's another
Yeah.
problem. There's a long waiting
Yeah.
list.
No, Islamic organizations, like for example, school, like IFS, for example, or CPSA, they usually don't prioritize having a counselor on top of the list. You know, they're obviously private schools, they're not getting government funding, so because the budget usually gets pushed
Which
to
is
the
also a
end.
huge downfall, because at the
Of
school
course,
system, you
Of
need
course,
to have.
yeah.
counselors.
And I think that's where the community needs to be very, you know, they need to kind of make sure they motivate the board and let them know it's important. I mean, I think CPSA still does not have a public counselor. I know IFS now has one, but they've kind of, because of low budget, you know, and then the burden is on, like Khalil Center, for example, it's hard to then manage. And then on
Yeah.
top of that, we're a nonprofit, we don't turn anyone away. And so, you know, we end up, I think, last time I calculated, our average session fee that we collected was like $72 or something, right? And that's pretty much what we might pay our provider, right? So as a nonprofit,
Yeah.
right, so and that's a very low pay for providers who are, you know,
Yeah.
like doctoral degree
Fair.
holders. And so then I don't blame them if they don't want to work at Khalil Center because, you know, like they need to, yeah, they have to obviously support their family. So it just kind of goes around in that perspective, and that's why we've kind of shifted towards more prevention because, you know, hopefully we can strengthen families, imams, know what mental illness looks like, board members,
And
you know,
have proper
parents.
training for the imams, because.
Yes.
Not
Yeah.
necessarily,
Yeah.
they wouldn't
Yeah.
know. the psych-
So I would like to add to that as well, because there are so many different aspects of this need. So I think actually one thing would be that the Community Mental Health Board could also help out. So we could establish a regular person, at least to do the triage, at least to screen people and see who is in need. Now, this institution does a lot of services, but their services are focused on people's immediate needs, like ICMA, like, you know, so people come here for, they need help for housing, you know. I know, you know, that this, you know, like, somebody has a job, their car broke down. The boss will help them buy a car. They do these type of things. They help people pay people's rents and things like that. There are a lot of medical doctors in our community. They do free clinics here. So they will come and check people's blood pressure and check their blood sugar. And then, you know, sometimes they do vaccinations and things like that. But as far as the mental health is concerned, I don't think there's enough emphasis. And it's also like the kind of ignorance, like one of the imams at one point was giving khutbah, was giving the sermon on Friday, and was saying that all you need to do to be happy is to pray hard and read the Quran and do all those things, and then, you know, you can throw away your medicines and everything. And so after the sermon was over, I went over to him. I said, Sheikh, you don't know, but I know that there are people in this community who are taking their medicine for serious mental illness, like schizophrenia and something. What do you think will happen if they throw away their medicine today? He said, well, I didn't think about it. I said, I don't think it is. But, so there's that part of it.
Very important. We need
Yeah.
something.
أشهد أن لا إله إلا
Okay.
الله.
It listed a few of the gaps that we have, and I love the fact that you're talking about.
أشهد أن لا
Because I totally
إله إلا
and
الله.
that's the best answer.
It will end in 30 seconds.
Oh.
Can this wait till?
It'll end in 30 seconds.
Yeah,
Okay.
maybe that's a good idea.
All right.
أشهد أن محمدا رسول الله. أشهد أن محمدا رسول الله. حي على الصلاة. حي على الصلاة. حي على الفلاح. حي على الفلاح. الله أكبر الله أكبر. لا إله إلا الله.
You were saying?
Yeah, I was just saying about the police department, you were saying, so
Yes.
we have a very great relationship with Glendale Heights Police and the village, and then DuPage County and
Mhm.
others, so we have 120 partner institutions, and I think most important institutions, institutions we have are masajid or mosques.
Mhm, mhm.
So without our mosque, ICNA relief will not be able to survive. We call ourselves extension of the masjid.
Right.
So anytime any sister sitting upstairs in the night, need housing, Masjid Imam called me, even at 11, 12 or 1 a.m.
Whatever
in the
time.
middle of the night, that the sister is sitting here, she needs housing or anything else. So I mean, we have so much positivity. This is how we grew. We just build on our strength and positivity. Muslim community is heading in that direction.
Mhm.
There, we have like a lot of, educated and professionals in our community.
Right.
We just need to tell them what needs to be done, what is important at that time, especially for the board, mental health board and
Yeah.
others. So I think what we need to do to, next step should be to start sharing this information and start letting them know.
Yeah.
The more we will tell them, like, for example, in Jummah, Friday sermon,
Mhm.
the more we inform them, the more they'll be aware and they'll do it. So we have a lot of, positivity around us. And I don't see any other community and, other than Muslim community who are like taking small, big initiative, although we are smaller in terms of the percentage here.
Yeah.
But we are working and heading and taking a toll on us when we talk about mental health or homelessness or housing or many other projects. We are leading in many areas.
You are.
So when COVID hit, we were on the front, Muslim community was on the front to take care of COVID and other things. So I think when we join hand and when we inform our community members, they will be all for it.
Mhm.
There will be very
So-
little resistance.
It would be wonderful to have
Yeah.
some Muslim
Yeah.
Yes,
on the boards,
yes.
on all of them.
Absolutely, absolutely. This is the most important because we are working so hard, our community is working so hard, but we are not represented.
Yeah. Yeah.
So
Yeah.
it is the must
We
and
need
vital step, yeah.
representation. Yeah.
Like when I mentioned about 88 nationalities to board, DuPage County Board, they were all
Everybody's
shocked.
surprised.
88 country of origins come to Glendale Heights Food Pantry. Can you imagine that? 88 country people are living in tiny Glendale Heights.
Yeah.
It's not heard of, right? They didn't know that which countries, okay, list the countries. We have the name of those countries. I can share those.
And you have the people.
Yeah, we have
You
the
know the
people.
people.
Yes. So.
Wow, well, that's important. That's super important. So that's a plan of action.
That's a plan of action.
That's a plan of action. Can anybody else think of a plan of action that we would need to do besides having representation on the board? Communication with our community members, as well as our trustees, our schools, our police, other people in the community that are movers and shakers. Okay. Well, we're out of time pretty much, almost out of time. Does anybody else have any questions that you want to ask? I know we just left the surface.
So, real quick, so at 708 is the name of the actual program, and it's with different townships, is that what that?
Yeah, and they have a website, it's called Advocate for 708. And you can find most of your answers there, right, Mike?
Yes, and the 708 actually refers way back to the 1970s. That was the original House bill number. So they're called 708 boards. Just historically, it has no meaning other than that. We probably shouldn't.
Isn't it?
That's where tradition sometimes takes precedent over reason.
And, we are asking for, we are just informing the community about 708, so they can decide to choose.
They
yes,
can decide to vote for creating a board in
Yes,
the township or not. Yeah,
so we,
right. And so if you believe in it, you're gonna wanna share it with others, the information about it. And I know some people have voted already, but there is still time. A lot of people won't vote until November 5th. So there is time. We have door hangers
Yep, over there.
that I have been doing, and people from my church, and St. Paul is helping now. So I've got a number of faith-based institutions that are going out and putting the information on the door, and the ballot language is actually on that piece of paper, so people will know what it is and what it means. And I always tell people it's near the end of the ballot. Do not you have to go to the end of the ballot. Anybody else have anything?
We just need to spread this word around.
Yeah.
That's
You do.
it. Yeah.
We need good WhatsApp messages.
Yeah.
this
Yes.
week.
Exactly,
Yeah.
exactly.
Spread it.
Yeah.
In a
Yeah.
minute, it will be all.
So share with your
Yeah.
family members and the people that you don't see here tonight.
Oh, yeah. No, because
And this
nobody
will be,
knew
is
people would have
we're
come.
recording
They knew.
Well,
or not?
yeah, we're recording.
could probably
so I'm
share
gonna turn the
this,
recording
too.
off. I will tell you though that,
I want to say thank you though before you turn it
yeah,
off.
go ahead.
Okay, so I'd like to thank our panelists who are knowledgeable and caring and very special people. Thank God for all of you. Sharing your knowledge, and for all of you who spent your evening with us. And please share what you've learned tonight with everybody. And thanks to Mike Murray, our champion for Illinois mental health boards. And reach out to Mike or to our mental health board members that have been in action for a while, like Milton, Addison, and Bloomingdale. They're right around us, and those people are super knowledgeable. They've been through it. They know what they're doing. I've heard some of them, and they're just amazing people. And then our next task is to vote, and let your people know that you're gonna vote. And we need people, if we pass, then we're gonna have to jump into gear and find people to be on the board.
And can I thank you as well,
Yeah.
Jerry,
You're
because, thank you for putting this all together. You brought it to us. It wasn't like, instead of us going to you, you came here, you asked to host an event here. And Mike, thank you as well. And you've been kind of communicating with us. I wish we had a bigger gathering, but whatever we have, we thank you for the efforts that you're making and the heart of gold that you have, and how you're trying to reach out and spread the word and, get more support all around. So thank you very much. God bless you.
Thank you.
Thank
Jerry.
you, Mike. Thank you, Jerry.
The election could be decided by as few as 100 votes.
Wow.
So that's why
Every vote
you
counts.
might think that this is a small group, but I think in Bloomingdale, we won with about under 200. We won in Milton. We were behind at the day of the election. And we got enough votes for mail-ins and we won by, once again, very few numbers, just a couple hundred votes. So that's, even though this is a small group, if each of you gets.
Oh, yeah, we'll spread the word around all
Big
right.
difference.
So would this also be in DuPage County?
This is in DuPage County.
This is DuPage County.
Yeah,
This,
but it's by your
York Township.
township.
this is just your community.
Yeah,
So it's gonna stay right here.
so York Township is part of Elmhurst, well, most of Elmhurst, Villa Park,
Right.
most of Lombard, what am I forgetting? Into the south part, close to Downers Grove, Oak Brook, those are all York Township. So
Yeah.
we have a lot of people to reach. So we're doing it.
Thank you again.
Thank